then he has not been. So see, he has not been.
Agreed to us when they said service provider, whether it's the sub or it's the one, they didn't mention this one is sub. All we know is that we came also with the MEC, we spoke to him.
Okay, let me understand, CEO. Since I left, because I was here, when did you visit this area to see and understand what's happening?
We also came back on the 14th when we reported back. So
then from the 14th, when did you?
I always come because it's just right here. I always come. I was here also on last week on Thursday, just to come and check how far is he, because the only thing we saw, he said we did measurements. Actually on the 15th, the project manager for the department came back after he has reported on the 14th. So the only thing they did was to take measurements. They said they ordered parts which would come on the first week of May.
Chief, what's happening here?
We basically, like the agreement that we had previously, we engaged the contractor to say he must be back on site. We wrote him a letter, and then a day before the expiry, she came back to site, but still she was still writing some issues that we had to engage with her on the new scope, because particularly the ICU has issues that has to do with the new scope, where the clinician said this wall needs to be broken. We have agreed with the contractor, and then the one for HVAC, like the CEO is indicating, we are busy with the installation. There are items that they will install next week, but the main contractor is on site with myself and the team on Thursday to look at the civil work that needs to be done. But what I can indicate is that the preliminary date that we've agreed with the contractor for handover for finality of the whole project is the 31st of July. And then August we hand over the project to you, yes.
Yeah, there it is. Them, do you have anything to say?
What we will continuously be doing, Premier, is to monitor the contractor, and if there are deviations, then we will inform the Office of Mr. Ramawa and also contract management, because if there's no progress, we have to take action.
DVG, where is the contract? Did you bring the contract manager of the department? No. You didn't bring that contract, because that's where we are being failed as government. If we are not managing our contracts, end users are end users, but the contracts are supposed to be managed at the provincial office. So when you end users complain about any contract that is not being adhered to, the contract management must kickstart the process. This contractor should have been terminated a long time ago. That's why even now he just came, because he heard I was here and I gave him the deadline of the 15th. He knew that on the 15th I was going to terminate him, and I was very clear at DDG. Now, by my wish, I would have long terminated him, and he would have had a bad name in the whole country. That I must tell you. We were going to meet in court. It's one thing that you must know. Even now, Boramawa, you must tell the contract. The Premier is personalizing this. And people think, well, I just come and just make a lot of noise. I'm personalizing it because I'm losing patients because of renal. They can't get access to renal. Yesterday we were celebrating Freedom Day. How do you celebrate Freedom Day when you can't get access of renal dialysis? You understand? It doesn't make sense. In this day and age, 32 years into democracy, you should be having access. We can't be taking all patients to Polokwane. It's impossible. So DDG, tell the contract. The Premier means business. Because I'm saying to you, now you are giving me the date of the end of July.
End of August.
Now you are, I want to hear. What is the, because she's saying end of July, August, you are saying end of July. What is the deadline for the completion and handing over of this? You know why I'm saying this, DDG? You have completed Chirizini. You even sent me. I was here when I was talking about Chirizini. Do you know what you are saying? I must go and hand over Chirizini. Do you know what is going to be said? All over. You're setting me up. You people are setting me up. No, because how she doesn't want her own people to die, but Letaba, when is she finishing? And who will be starting those people in your offices? That's why I suspect you have sent them. So you are setting me up. It won't happen. I will terminate you if you are not terminating the contract. I don't have direct line to terminate contractor because PFMA doesn't allow me. But HR delegations, they are still mine. DDG, they are still mine. You don't think I'm excited? You sent me to say, Premier, I've delivered. She sent me. Dr. Libakwad, Premier, we have delivered Chirizini even with the MEC. Hey, Premier, everything date, you are setting me up. I can't be going and say I'm cutting ribbon here, Chirizini, when the project started together. Here, when I don't know what is happening here. You are going to finish this one. MEC, I can't terminate the contractor because Nalwana PFMA doesn't allow us. I will terminate them because HR delegations still with me. I will terminate them so that I can get others who will terminate the contract. And then you will take me to CCMA. I will go myself. And you know what will I do? I'll be carrying the letters from Mogo and Tate Silomo, a number of nephrology nurses and nephrologists themselves when they are complaining about why we are failing to complete this. I will not only take those letters, I will also at the same time carry death certificates of all those who died because of they could not access renal dialysis. And I'll go to whoever is a judge and show them, you are lucky, I honor your relative. The day they will be your relative, you will understand why we terminated that contract. So I won't even delegate. I'll be there myself, go court, looking at the judge with all these death certificates. Because we can't continue to be insulted as government. When we have given people jobs, they don't want to do jobs. There are many people who are unemployed. We must allow them to work. And when I come for the next time, I won't be smiling. Na MEC, welcome MEC. Hasan na MEC wo ke tswa wa lerata ke mme wa lena le ga bolela le lena o bolela ka lerato ana ke na eno nna a ke nna lerato lewe go batho ba o se dire mmereko. My love, you earn it. My respect, you earn it. How do you earn it? Especially when it comes to patient care. Your department, it's a very sensitive one. That's why I get up like a boy. And then I won't stop. They might be us writing now, Jomoson, she's here. Jomoson, I'm here. And I can move not even an inch. Hey, Premier, Dumela MEC drink. Oh, kita mo remisi utlo mo ale bujor banaba ka fetjang kito tagara emisi au ba butiso ba bujor ale sa fetji ke ale terminate. That's it. Until such time I don't khona tjeo ke no phela ke morwala ke re tla o bona until judge la tla doctor mo loko minga head I'm terminator. No loko no mo bona sungula kwenda sweswo hayi nita bona ningeti mara sweswo one you're going to see me, but we are not really on a serious note. You understand your contract. I wish I could. Where is the subcontract? Who's here? You ran away.
No, he's around.
Where is he?
He's inside.
Call him so that he can go and tell his bosses. Or this is about lives of people. It's about lives of people. A health infrastructure can never be compared to any other infrastructure. You have seen, even during COVID, I told Mr. Ramau, during COVID, education, we were having online teaching. Universities were studying online, but patient care can't be online. Minjan, Mifuki, Aminan Sakang, Anisakang, va mi nyikile ntirho mara a mi heti ma swi tiva ku ri loko mi nga heti sweswi ni vulavula switani ku na munhu kun'wani somewhere laha a xifundzatsongo xa Mupani i lovile namuntlha loko ni ri tani because a nga kotangi ku kuma service leyiwani ma swi twisisa tomorrow ku ta va n'wina looking for this service and mi nga yi kumi loko mi ku na mina when I say we are fixing this for all of us tomorrow it will be me. I would want this service to be provided. So please, lava va fanele ku tirhisa leyiwani service a va na option loko va ri na option a va nga ta tika hina especially loko va hi tiva ku ri hi hava rasela they wouldn't come, they would go to private, they don't have. So I'm telling you my dear, this mi fanele ku ri mi hetisa. If you don't finish as per the time that you are given, we are going to terminate you and blacklist you. And I will make sure that the whole country knows who do not have heart, who are heartless. Because Mali have a budget ka health, they must finish this project. But it's not you, it's not your contract. Yes. That's what it's going to. That thing it's really uncalled for. And you'll find that the contractor there in Chilizini did his or her job. The contractor here is a failure. So the public must know who is failing us. It's not Dr. Ramathuba. Dr. Ramathuba loves all the people of Limpopo. No matter how much I explain, nobody wants to listen. Or no, but it doesn't. For the narrative to suit you, you are going to say that. The people of Limpopo, everyone, deserve my love and my support. So that one, mi babjela na boss ya mwina. Kuri abar kona self. Vare abachavi court. Anri inga is mfumo court. When you will have to pay for those lawyers. Mina, I will go to court. Mi babjela. Kuri premier bar bataya na wena court. And when she will go herself and go and be a witness and ask the judge, could these people who are dead, I won't bring them back. So you are coming to entertain somebody who can still breathe and eat pap at the expense of people who are gone beyond. No, we don't want this thing to happen again. August, I'm here. Nilaba Maki. August, Nilaba Kubona admitting our patients. You have started with the procurement of the machines. The machines. Machine, the machine is go. Leswi tiva ku swa dura swi huma kwi va Japani va kwi swi kona we have got them but leswi swi tsandzeka ku i swa n'wina I vanhu va ka n'wina tatana Makamba I vanhu va ka n'wina vanhu lava va lovaka a mi twi ku vava mi hi hlekisa hi valungu ka mi hi hlekisa hi valungu va te va lava mfumo hi va nyikile bona va endla yini. They were not doing this to themselves. We are doing these things to ourselves. And I won't stop talking. I will talk until you fix all these things. This okay. ABC, Meginali virtual meeting Minister Ramathuba. So that's why I had to drive fast. Sorry.
Phophi.
No, he came because of the deadline. That was the reason why he came. He came because of the deadline, and he has disappeared. So he must know. When I said I will follow this up,
Nashawa Musa. It disappeared. Musa? Musa has help.
see, what do we use? I mean, fixing all these tiles that are out. Well,
We have just finished inside the premier. We are getting our containers. They move and put the new ones outside. So we've just finished with the inside.
you know, somebody who runs private hospital explained to me that they prefer to maintain their facilities, which is much more cheaper than what we do in government. Every time you keep on saying, no, this is all we must do a new one. What is difficult in maintaining? Because that payment is there. It's just 1, 2, 3, 4, which is for the problem. What is difficult?
The challenge we have is getting the right size of the inside. That's why now you see the different colors. This is our neonatal ICU. Unfortunately, we cannot allow everybody.
Now, then I'm not going to go there.
This is our neonatal.
I'm going to issue a memo that no one must visit my neonatal units anymore. That one you will have to consider that no more visiting
So the
of
first
these
wing,
babies.
we are admitting low-risk babies who don't need intensive care. Toward the end, on my right, it's our breast milk bank, and then the door goes into the neonatal ICU. We have got 9 beds there. And then we also have, on the other left, the other wing is for KMC.
So how many babies do you admit at a go?
Okay. In total, we admit 20 when I include the neonatal ICU.
How many gynecologists do you have?
Currently,
Four.
I've got 3. Yes. 3 now.
3 gynecologists qualified. How many pediatricians do you have? 4 pediatricians.
5, including the head of clinical unit.
Including the head of clinical unit. So you are well resourced and well equipped.
Yeah. That's the joint pediatricians in general. We were left with 1, but at least we had 3
How do they support your district hospitals?
They do outreach, and for a schedule where weekly they do go out. At times, when they realize that there is no bed, there's a critical issue, the obstetrician run to the district hospital, not only waiting for the dates or the schedules.
So in terms of their visits to district hospital, the guy, how often?
They do it's weekly.
Which hospitals?
Kenzani, Kapani,
All of them.
Yeah, I can say all of them.
Right.
So
Okay,
they
I
do
want to see how they
They also go beyond the schedule, because if there's a case which is complicated and they realize that there may be delays, they run with their own cars.
Now that's what we expect them to do. And the other issue is that we do have aero medicine. In where it's a crisis, they are allowed. If you think for them to go and pick up a patient and bring the patient, there's no time. You can take them to the patient, and they go and resuscitate the patient there. And even if it's probably a ruptured uterus in theater, you can airlift him as a guy from here to Maputa Malati to go to theater and repair that uterus. Instead of you to say we'll pack the patient and fly the patient here. No, you must fly them there, and they must go and do what they are supposed to do, and after that they can come back with the patient for further management here. You would have saved the life. So some of you think, I'm told by other CEOs to say, why should this doctor? You must fly your doctor. If there's an emergency anywhere, you must fly there. That's why we are having that. It's just that you will need to have to communicate with the HOD to agree on that, so that we can be able to reduce maternal mortality. We are done. Let's stop OPD and casualty. Then I will go. I just request the clinical team, which was managing our complex, just to brief us what has transpired. And then I will then be told others. Where's the OPD? Maralibo, you don't have the rightful size. They've just finished. Where is the? It's here. You don't work with sneakers is a must. If you're waking to now unless my donor could another one, it's fine. I will not nothing color, other color, it looks like it's a decoration. Yes, I need you. But the issue is that you must maintain inside. How does this yeah, morning, doctor. How are you? So the mask area over here. Mask how are you? I'm fine. And you are Dr. Trolley.
Yeah, I'm the concert.
Oh, you are doing community service here. Yeah. How is working here?
Very nice.
It's nice.
Wonderful.
The team is great.
Yep. So impressive. So many people. Yeah. No, it's really beautiful to work.
Okay.
Wonderful team. And the nurses.
The nurses are great.
I'm from Joburg, so.
You're from Joburg?
Yeah.
But you love it here.
I love the nurses.
You love the nurses here. And you're not saying anything about the nurses of Joburg, but what you're saying is that
I'm just saying.
you are loving. No, I agree with you. What you're saying is that you love the nurses here.
Yeah.
That's good. Thank you very much. Yeah, enjoy your stay.
Thank you.
If you have problems and they are bothering, I'm available to resolve.
Thank you.
Right?
This is face doctor.
That's what?
Dr. Trolley is face doctor.
Is what?
He's the one that treated Faith when we were
Oh, the last time.
Yes.
Oh, you are still out. Thank you very much.
No problem.
Oh,
Yeah.
Okay, does your patient remember you? Do you remember your patient? You remember your patient?
Yes.
Then you save her.
No, don't say.
You did. You did save her. Because when I'm working with my team, I keep on telling them every day, when we're fixing these hospitals, we're not fixing them for some poor people somewhere. We're fixing them for ourselves. Because health care does not have an appointment. I can collapse here. I have a medical aid. But if I collapse here, it's only Dr. Trollip who can help me and this hospital. My medical aid kicks in when Dr. Trollip has resuscitated me later and give me a nice TV, nice 3-course meal. But the person who actually saved my life, it's Trollip in Letaba. So that's why we must fix these hospitals for all of us. So well done. We are done. So we are done. Yes. I wanted to guide you the stuff. How is your OPDQ? And then how is your Tutuzela Center now?
Still the empowerment area. They're going to come write a letter to request authorization to come ahead. They want to do your drive. There's a mobile inside of there. Yeah. So the admission was there. You have your advisory this way. So this one they say is not
So what is the problem there?
OPD.
OPD.
Yes, because show the admission and
While they are saying they are going to use why can't they, I mean,
Many more.
those that can come and see.
Musa, driver yam.
Ungaveza abantu.
Okay.
China. Hey, Abusheni. Ninjani. Mifikiri. Foi nafunzi. Faidi ya mwana ikwini bwana. Ni nge koti ku twisisa problem ya n'wina, ni nge koti ku solve problem ya n'wina. So loko mi vulavula mi fanele ku vulavula one person at a time. Ene na munhu I yimisa voko. Ene tshama ni mi byela ni ku Xikwembu xi hi nyike tindleve timbirhi ku ri hi yingisela ku tlula ku vulavula na nomo wun'we. So loko hi vulavula swo tala hi nga yingiseli swo tala hi nge koti ku ri hi pfunana. Sungulani I papa lava a va lava ku vulavula.
Ni fike hi 7 na mina na sweswi na
Mi fike hi 7. Va ri problem ya yina I n'wini I yini?
ni va nyikini xitadani lexi va kota ku ni tekela fayini.
Okay. Who is in charge here? Yeah, Mr. Minyuko, can you explain? Because there was a time I used to send people to come and benchmark at Letaba Hospital because your queue management was great. What is now happening? Where did you lose? You dropped the ball.
I cannot say that the number
of loko mi nga yingiseli mi nge vatwi tatana Minyuku va hlamusela ni kombela mi vulavula hi leya shop sword voice maitsundzuka leke loko ku Amanda hi lava increment leya ya PMDS a hi vulavula hi voice leya a ni ri na mina a ni ri na n'wina hi vulavula hi PMDS.
Okay, all right.
Yes.
a hi twananeni lexi endla ku ri hi hlwela I mhaka ya ku ri nambara ya n'wina yi ngetelelekile mi ta mi tele exibedhlele so that's why vona hi mi hlwerile
se loko mi vona tinomoro ti tala ti increase strategy xa n'wina xa ku countera ku ve xa yini
I think that's what we can work out.
yeah the CEO.
Thank you so much, Premier. I always come here in the morning. We've got a gateway just across here.
Yeah.
First thing I check, who have letters, who have been referred. Majority of our patients, they are primary MK patients who don't via the clinic. I would then request them, can we now go to a gateway where you will be assisted and you're not paying anything? It's only when the nurses that side realize that your condition is beyond the clinic, they will refer you. Our people don't want that. They say Letaba as a specialist. We are now seeing patients who were supposed to be going to district hospital. For example, we have got patients coming straight from Mapushan to Letaba Hospital, from Kelis in Marule. We've got patients coming from Goma, directly coming to Letaba. So when we explain that when you arrive, we've got a queue, that site is for emergencies. Here, we are booking patients. Our chronic patients are booked. So we will have a list with their names, retrieve their files. But if I come, I'm not booked, no one knows that I'm coming. And when you arrive, already people are full. So we'll attend first the people who are booked. Only emergencies will be sorted and taken to gateway first. But the others, we do request them. So let's go to gateway. Maybe I can go with you now. We'll find the benches in gateway. No one.
We're going to go
yes,
there.
we'll go there.
So where is your triage here in OPD?
I've got two marshals here.
Yeah, where
I've got
do they?
two people who are here
Yes.
on daily basis to assist with queue management.
Yeah.
Who are also strengthening that, but people will tell them we've got the right to be here. You can't tell me to go to the clinic. Other times when they go to the clinic, they instruct the nurse. I don't want to be seen by you. Write me a letter. I want to be seen by a doctor.
But the nurse must write.
We told them.
I have seen this patient.
They write.
She said she doesn't want to be seen by a
They do
nurse.
write.
She is going to be seen by the doctor.
Yes.
So that they go and sit here and see the doctor, and the doctor says, I have seen the patient who was supposed to be seen by the nurse. The patient must go back and be seen by the nurse.
What we're doing, we're
Yes.
established a WhatsApp group Premier, with the doctors, all the doctors in OPD, including the senior clinical manager, myself, and the nurse manager, from all our 15 clinics. We have agreed that all patients will be discussed there so that they can advise them. If they need to be stabilized prior coming, some they are even advised to be treated and be told on how to manage them. Those are the patients that who have gone to clinics, but the majority, they bypass primary.
Vanhu va ka hina ni twile CEO va vulavurile ni lava ku mi vutisa xivutiso I vangani ka n'wina va nga khoma mapapila yo huma xo sungula a ti-district hospitals ta vona xa vumbirhi vo huma a titliliniki ta vona I vangani ma swi vona ku ri ni kombela mi yingisa loko no kombela papila mi ta ni nyika ni lava ku vona mapapila ya n'wina okay ni lava ku mi ni twisisa kahle ma va vona ku na vavabyi va nga khoma mapapila ya ku huma a titliliniki man'wani a huma ka swibedhlele swa district va te ku vona ti-specialist mupani I xibedhlele ni kombela mi ni yingisela a ni ri mafoni ka munghana lonene mi hi rhuketela na khalanga ku ri a hi lavi ku mi hlayisa kahle se ni lava ku ri mi twisisa ma vona papila leri va rhumewile hi nese ku huma a tliliniki va fike a tliliniki va queuewa se va va nyika papila ku ri va ta laha a xibedhlele ni lava hi twanana hinkwanu ka n'wina loko I ri na papila ro huma a tliliniki CEO lava va ta va endla ku triage va fanela ku ri va endla ku ri because u pfuke nampundzu u yima queue lawani I nge yimi queue again ku fanela ku tiveka ku ri ku na fast lane ya lava va humaka ka titliliniki lava vo pfuka nampundzu va ku vona va lavi ku ya a tliliniki bona a va lavi ku ya ka swibedhlele swa kusuwani na vona va lava ku ya a Letaba. Loko va fika la va fanele ku sungula a tliliniki le loko va nga lavi ku sungula a tliliniki ku to va vona va hetelela laha hi ta va vonaku loko hi hetile van'wanyani lava. It's unfair ku ri munhu a ye queue a tliliniki a tlhaya matliliniki laha ku na van'wani I sungula a tliliniki va n'wi rhumela a xibedhlele xa Khensani a fika xibedhlele xa Khensani va n'wi rhumela lawani lava vo huma a swibedhlele I vona vo sungula hi fana ku vona vona I ti priority number 1 ka OPD lava vo huma a titliliniki I ti priority number 2 lava vo pfuka nampundzu va ku ni ta va kombisa ku ri I mina mali mina ni to ya xibedhlele ku ta va ti priority number 3 loko hi hetile hi lava wani vo huma a swibedhlele so mi swi twisisa before mi complaina mi sungula a tliliniki so loko I nga ri na papila ra le tliliniki I nga complain na mi kombela because va ri tinomboro ta n'wina ta engetela so because the numbers are increasing CEO you've got to change how you do things you've got to enforce the referral system everybody must go through the hospital emergency they go straight to casualty if you are an emergency you arrive here we direct you straight to casualty if you are not an emergency you must have a referral letter from the hospital you become first to be seen here you must be a referral from the clinic you are second to be seen you are not referred by anybody you must remain there we will see you after we have seen those who have been queuing in other facilities before Letaba. That is the only way you can manage the queue. Otherwise, you won't manage the queue. Yeah. Okay. Hey. You want to ask?
Yeah.
Yes.
So if you are taking the medication for chronic every month, what must do what?
Agree how chronic medication?
Yeah.
It depends. One, how is stable? Ka medication wa how? Ru refera back o tshwana le ba. Re ba refera gore ba yo tšea medication go clinic mo ba ka SQA. Ba bangwe re ba registera go programming we re bitsa CCMDD. A o ye queue wena o no fitla kwa ba o fa dithare ka nto after 6 months ba tla o ngwalela gore o tlo o bone doctor. O tlo tla ka lengwalo le o ka CMA queue. Be anong hona le ba le re tsebang gore ke di special cases dithare tša bona o ka se di goetse go clinic ba bonwa ke di specialists specifically kudu re lebeletse ba o tshwana le baimana ba high risk so bawe o atla o na le card e doctor o fang yona doctor o amuja before o tswa a ngwalele return date o boya ka card ele ya hao ina le return date o tshwana le ba o tswa sepetlele ka gore card ya hao ina le date ya doctor o ka se eme a utswi o tshwana le batho ba utswa dipetlele tše dingwe o ka se eme queue o ba priority number 1 ya kwa no aniri that's why ni lava ku solve a problem ya le n'wina mina loko I ri na referral aniri ava nga swi endli la ni va byela ku ri va swi endla loko ku ri munhu ina referral na date ya ku vuya ya doctor hi vona va ta prioritisiwa lava hi ku hi nge va voni before hi vona n'wina hi ta va vona mara hi ta va vona mahetelelo na hi 5 hi nga va vona I lava wani vo pfuka nampundzu a ri ni ya a Letaba va ri ku na di special doctor ni ya a Letaba lavo va nga complain mara lava van'wanyani we will start with them so the marshals I've told you what to do start doing your work.
My employer does not want a letter written by a nurse. So if someone, like now,
I want sick note.
Because their employers will tell them the nurse will only give you proof of consultation, but not sick. So hence,
It may because you are not sick enough.
not sick
If
enough.
you are sick enough, even the doctor that like will only give you a letter that this is consulted me today. It's not every illness that requires a sick.
today we have patients.
Actually, where is the OPM? Also, you even have a doctor here.
Yeah, where there are orthopedic doctors. To attend to them.
Also, these patients are for the.
These ones are for orthopedics.
Oh,
Going to the side of
these
my
are
health
for
care.
orthopedics.
Yeah, these are for patients.
Okay, hold on. These are not the PAs. All right.
Nakomba the empty book.
So they don't want to stand up. Saying the only way is for you to reinforce. Reinforce by making sure that your marshals are waiting. When the patient comes, they see it's a referral from the district hospital, the patient is being prioritized. It's a referral from the clinic, the patient is being prioritized. It's somebody with no referral letter, with nothing, they tell them waiting. No, the nurses must just cooperate. Where's the OPM?
Yeah, we just want to check the OPM. Okay. Where's the second in charge?
Are they busy?
Yeah, they are not so busy because of people bypassing coming to the side of the hospital. So they are calling the second in charge from the other side. Yeah. So this is your dispensary. Yeah. And they do CCM.
But isn't that if they don't have medication here, they can always...
No, they always have medication.
No, if they don't have, they are closer to the hospital, they can always request from the hospital.
We have already transferred
The clinic is now belonging under the hospital.
to the hospital. Under the hospital, it's only just for electronic data that actually goes to primary health. Because we felt that the day they will need to assist each other. So all the reports to the metro.
Do you have flu? Because I see a nurse. Yeah, I'm saying if a nurse puts a mask here, Rena who are ordinary citizens will put it here because the nurse put it there. So because we learn from you, yes, they are raising issues. We have got a problem in our community, and we realize that here at our clinic, patients are not here. They bypass, they go straight. The doctors that side says when they refer them back, they come and tell you to say, we don't want to be seen by you, we want to be seen by the doctors. So this is my advice to all your nurses. You must write in that letter, the patient has refused my treatment as a professional nurse. They are demanding that they want to be seen by the doctor. The doctor will still tell them, well, this is how the system functions. You must be seen by the nurses. If you are not satisfied, that's when you will come to us. Or the nurses, if they see that this condition is above their scope, they will refer to the hospital. If we do that, we'll reduce the long queue. Yeah. So that we allow our specialist doctors to deal with not flu, not cough mixture, not abscess or a small cut, which you can suture easily. You must also tell them, we are the ones who train even the very same doctor how to go to their first meeting and suture they are taught by us. We are teaching them how to even cut the first episiotomy and deliver the baby and the suture. Actually, your doctors know how to do cesarean section. NVD, it's our specialties as the midwives. You must tell this patient, these doctors that you want to see, they are trained for certain. This, it's for us. The other issue is the lack of knowledge. Yes, it's the lack of knowledge. You know, it's like I was telling grade 12 learners, when they pass, everybody wants to go to a university. You go to a university, you do your own BA in arts. You've been to a university, you graduated, we had a party, but you come back, there's no job. You say those who go to TVET to become an artisan, it's low class. When they come, they have got a job. There are others, you've got 6 distinctions, no university, you want to do medicine, engineering, universities are saying they can't accept you. But there are other grade 12 who have done from those schools where they will do mechanical, they will do all those. You know, by the time they pass their grade 12, that's why even with 30%, we give them grade 12. It's a school living certificate. We give them because Toyota will hire them to go and fix their engine. Marawenaka 7 distinctions, you will be sitting. So we must explain to them to say, look, we are very good at what we have done. The doctors have got their own scope. It's this condition that you are bringing here, it's only me as a nurse who can deal with it. You are empowered now. Be fair.
Thank you so much. The letter you were holding was written from women. So just say, I want to go to look at the back.
No, we in the clinic, you must tell them to. The patient must go to the doctor. The sisters must write to see it.
You must just give us a moment.
So those are some of the dynamics we do before and we educate them. Sometimes we do first class education when we first talk to them about how we do the referrals to a level 2 hospital. We're going straight now. I don't know how.
Driver, languta ma friend head.
We are going up.
Zoom out completely.
We are coming.
Yeah, you queen.
We are there. Inside.
We are queen.
There's a number plate.
First, I need you.
We're going 10 left. It's possible unless we turn back. Ball.
It makes sense. No, every time when I see the program was finished yesterday,
What I did,
your side, but not on my side. Again? I'm not on my side, Katsi.